Let me talk a little bit about child care. I know it's a subject that we've received a lot of inquiries about. People are obviously very, very interested, particularly with school about to start. Many school districts, of course, are moving to online. Part-week options. What we're seeing from our schools is all kinds of different decisions, all kinds of different options. Families, of course, are tracking that, and families where both parents are working, we might have a single mom, single dad, they're making decisions about what they need to do along with their children. We know that children cannot learn unless they're safe, unless they're cared for. And without access to child care, parents may resort to less than ideal options because they have no choice for their child care. That might include relying on elderly grandfather, who would normally everything would be fine, except today they're at a much greater risk for COVID, and that would create certainly a great worry. We are announcing today that effective August 9th, child care providers in Ohio may return to their normal statutory ratios and class sizes. Child care providers will be given a choice, and we will spell this out in the days ahead. And let me just go back a minute. If you'll recall, the child care that has been on for the last several months during this pandemic, we've done absolutely everything we can to make it as safe as we can and to reduce the chances of spread of that virus. And one of the ways we've done it is we've reduced the ratio. Reduced the ratio, the number of children per room, per adult, per caregiver. It is clear, and while doing that, we have subsidized to the tune of, I think, about $30 million a month, child care providers, both those in the private sector that are not normally subsidized, and as well as those that are subsidized normally. So we've done that so that the child care community would have sufficient dollars to be able to run the child care in the manner that we felt it needed to be run with the reduced ratios. It's also clear, however, particularly with school getting ready to start back up, and a lot of different demands beyond parents, that system would no longer work. And we've received comments from people who had a hard time getting into child care. So what we're doing now, and what we'll do beginning in the first part of August, is we will give child care providers a choice. They can get a significant subsidy, and they will, if they do that, they will need to keep the small ratio, or if they elect not to do that, then they will go back to the normal statutory ratio. I know we've received some questions in regard to outbreaks connected with child care. Best data that we could come up with would indicate that we've had 442 people since the pandemic began. And of that group, 306 were staff and 136 were children who came down positive, who were in child care. Now, Jobs and Family Services went back and tried to determine, this is imprecise art, but tried to determine how many of those actually came out of the child care setting and how many may have come directly from community spread. And again, difficult to totally have that figured out, but it looks like about 3/4 of those came from community spread. About 1/4 came from cases directly that came from that child care setting itself. Even with increased classroom sizes, child care providers still have to comply with very stringent health and safety requirements. These include face coverings for all staff and children over 10, unless they have a health exemption. Symptom and temperature checks when staff and children arrive, washing hands throughout the day, including upon arrival and before departure, frequent cleaning of high-touch surfaces, and regular deep cleaning. Additionally, providers will report any COVID cases to the Department of Jobs and Family Services, as well, of course, to their local health department. We will continue to closely monitor reports of COVID everywhere, and certainly including child care, as well as we will continue to look at compliance with rules and best practices and respond as needed to keep our children, family, and teachers safe. I might add one additional thing to that, and that is there is a fairly large study that is going on that Ohio has participated in child care. It is possible that data that will come back from that, and we do not have that data yet, may necessitate or indicate some additional changes. But we'll have to see that study. It's a quite large study, not just in Ohio but across the country. But Ohio participated significantly in that study, and we anxiously await the results of that study. Let me just say to all our child care providers, those people who work every day, who are out there with our children, thank you. These are not easy jobs in normal times, and they're certainly not easy times as we live with this COVID. So thank you for taking care of the children. I know so many of you do this just out of a deep passion and love for children, and we are very, very grateful for that.